Well, first when I found out, well, I've always had this congenital condition. I never knew there was treatment for it. And so I was trying to research it a little bit more, and I found out that this is actually quite common in women. So I started Googling and found some various doctors that treated it, but I was looking for a doctor that I could, trust. Something that I didn't know much about. So I did some research and found out that he was a teaching physician, and I decided to go ahead and schedule an appointment, see what we could do. So that's how I found out about Dr. Nagler. I was really apprehensive at first about coming to see anyone, most because, with this type of, I want to call it defect, we're really embarrassed about seeking treatment. And the first time I came in, to him it was, I'm just a normal person. And it was common for him to treat these types of issues. So he made me feel at ease, removed all my apprehension, made me feel comfortable, explained the procedures to me, what the recovery would be like, and told me that everything would be okay. Okay. My official diagnosis is brachiometatarsal. There's two procedures that can take place. One is the one step, and the other is with the external fixator. And because of my age and for the risk factors, the external fixator would be probably the best option for me. That's the procedure that I believe Dr. Nagler most commonly does. Basically, they'll go in and create a fracture in the bone, extend the bone through the fixator, and help the toe fall in place where it should be. It was an in and out procedure that day, and the recovery is probably a little longer than I would have hoped for, but overall, the care that I've gotten here and the nurse and staff, they've been very helpful, very accommodating, very compassionate, and that's really, to me, the most important thing. Well, when I first came in, my first concern was my insurance going to cover this? How much was it going to be out of pocket? So, they looked into my insurance benefits for me. Pat was the first person that I talked to. Immediately, they looked at my coverage. Shortly after that, we went ahead and set up, the surgery. She emailed me all the information that I needed, set up my surgery with the surgery center, and that was pretty much the first part of it. After the surgery, my first post-op visit was just like 2 or 3 days after, and I was in and out. They changed the bandages and dressings, and made sure that I was comfortable. They scheduled all my equipment that I needed. I needed the scooter, crutches, a cryotherapy unit, all of that. So overall, my experience here has been wonderful. This is really a difficult procedure, and you go in not sure how this is going to work out, but they've been very supportive. All the treatments, he always comes in with a smile on his face. He always puts you at ease, and that's really, really important when it's not the most comfortable procedure to go through. So every little bit helps, and it's encouraging.